Our lesson today is going to be on the circulatory system and where does blood actually go. We cover the respiratory system and learn that our oxygen gets to our bloodstream through our alveoli, but where does it go from there? So we're going to basically go over the basics of the circulatory system. So what is the function? It's a group of organs and tissues that are going to move the essential supplies to the body. So the purpose of the circulatory system is to get that oxygen to the body so that all the rest of our organs are able to use it, and it does it through the blood. Now this system is also called the cardiovascular system. The three main parts are the heart, blood vessels, and the blood. Blood vessels do include the arteries, veins, as well as the capillaries, which are little tubes that connect the arteries and veins together. So we're just going to go over the basics of all three of these parts today.
It's making you dance. What do you listen to? Dance it out. Dance it out. You want to show everybody? You want to show everybody? Yeah, you do. All right, here we go.
Now we're not going to listen to Kelly Clarkson or watch a little baby dance, but just a little baby sitting in the chair was able to get her heart rate up just a little bit by moving her arms just by the beat of some type of music, and that's an easy way to get our heart rates up. The heart is the organ that's going to pump blood to the body. We need our heart to work. On average, our heart beats about 70 times per minute, with the range being 60 to 100, and that's our resting heart rate. So if we were to sit and do absolutely nothing at all and check our heart rate, this is where we will be between. People who are a little bit healthier, their heart stronger, I should say, will have a resting heart rate closer to 60. Those people whose heart needs to work a little bit harder, their heart's going to have to pump quicker, so they're going to have closer to maybe that 90, 100 beats per minute again, and that is at rest. Now with blood vessels are going to run throughout the entire body. We have our veins, our arteries, and then I mentioned at the beginning our capillaries. Veins will carry blood from the body back to the heart, and that's deoxygenated blood. So the blood's already dropped off the oxygen where it needs to, okay, and from the arteries, and then it sends it back to the veins. So arteries have the oxygenated blood, and then the veins have the deoxygenated blood. We need both of the arteries and veins to work so that they can get oxygen to the body and they can rid the body of any type of carbon dioxide. Now with our blood, we need blood in order to live. We have four main parts of blood. Plasma is the liquid part, which is primarily water. We have our red blood cells that carry oxygen to the cells and carbon dioxide away. Our white blood cells fight disease and infections. If you've ever heard of white blood cells, usually our white blood cell count is a little bit higher when we're sick. If you've ever had a cut and you had pus, the pus is the white blood cells that are actually dying off because our body's saying, hey, we have an infection, we need to fight this off. And then we have our platelets, which help our blood form a clot. If you rode your bike before and you scraped your knee and it formed a scab, that's our platelets that are going to be working to close that off so we do not bleed. Now we want our body to clot. We want our blood to clot. We don't want it to clot inside the body because it can increase the chance of heart attacks and strokes. But when it's on the outside of the body, we need it to clot so that our body does heal any type of wound that we have. We do have the different blood types that are listed here. There's 8 different blood types. Each of you has a different blood type, one of the 8. And with that, some of the blood, when we're looking at blood that we're compatible with, if we ever need a blood transfusion, universal donor is O negative. Those are people that need that can donate to anybody. So if you have O negative blood, you can give to anybody at all. If you have AB positive, you can receive from anyone. Some of you may want to go home and ask your parents, do you know what type of blood I have? Or some of your parents may even know their own blood, especially if they donate. So really only something we have to know if we're in a situation where we do need to give blood or get blood, but it's always good to know for those of you who want to help out the community, practice some citizenship, and to donate. But blood pressure is the next thing that I want to talk about. And with blood pressure, most of you have gone to the doctor before. They put that cuff on your arm, they blew up that cuff, and then they let the air out of it, and then they may have said a number to you, and some of you may have said, I have no clue what that number means. When I stick my arm in that cuff at Jewel or Walgreens, I don't know what those numbers mean. And they're telling you systolic and diastolic, the highest when your heart beats and the lowest when it's at rest or between beats. And the average is about 120 over 80. A lot of you in here, because you're younger and healthier, your resting blood pressure should be a little bit lower. Anytime you exercise, you're underneath any type of stress, your blood pressure is typically going to be a little bit higher. And with high blood pressure, it's called hypertension. The heart's working harder and our arteries are actually taking a beating. So we don't want our heart to work any harder than it does. And if it does work harder, we do risk a stroke, heart attack, and kidney problems. And oftentimes people say kidney problems. Why? Kidneys are the furthest place in our body that's going to get the blood. So if blood's going to the rest of our body, it's not going to get to our kidneys as quick, which ultimately, no blood, no oxygen, kidneys may start malfunctioning. Two other problems that can happen besides hypertension, high blood pressure, are heart attacks and strokes. Heart attack is blockage of blood to the heart. Stroke is blockage of blood to the brain. Now, when we're looking at the heart attack, somebody usually knows that they have a heart attack, or some signs will be the pain in the chest, shortness of breath, cold sweats, and they may notice, hey, something's not right. But we can get pain in the chest when we're dealing with anxiety or other type of issues as well. But the signs, usually if somebody knows that they're having a heart attack, they're going to show the signs that are listed here. People can overcome heart attacks. They can have silent heart attacks where they never even know that they have them. And then strokes is a blockage to the brain. Since our brain controls everything in our body, any type of numbness, usually on one side of the body, reason being the right side of the brain controls the left side of the body, the left side of the brain controls the right side of the body. So person may notice that numbness, they may get a headache for no known reason, have that loss of balance or dizziness. And any type of time anyone has any symptoms of heart attack or stroke, it's important to get to the hospital and to get that taken care of right away so that nothing additional does happen with that. But people with strokes can live. Sometimes people with strokes do have to go through rehab because their hands may be a little bit numb. They may need to learn how to talk again, to walk again, depending on what type of their brain was actually damaged. This website here, you can click on it. It does bring you to the Kids Health website, or you can type it in, and it will give you some additional information on the circulatory system and just kind of a different way to look at it as opposed to watching this video. So take a couple minutes, fill out the note sheet, and we will be discussing this information in class on Monday.